Up next, you all just heard from her, but she's gonna be on stage again. Jill, who is one of the co-leads of the parent working group nationally, is also the co-lead of their parent and patient advisory team at MassGeneral Hospital for Children, and they've spent the last year building a guidebook for how to build patient, family, and clinical partnerships at the local level. And I want to turn it over to Jill. Jill, are you there?
I am. So thanks, everybody. I appreciate having the opportunity to speak to you again. So just a quick overview. We were the proud recipients of the first Parent Innovation Award last year. And so our year-long project really was chronicling our journey to engagement. And so one of the things that we felt really strongly about is that as a center, we wanted to make sure that all stakeholders were represented and that we had this cohesive team. The problem was we didn't know how to get there. And so there's been some wonderfully successful efforts up until this point from other centers. And when we went to community conference, we always felt like we were missing a piece of the puzzle, that they had these really dynamic teams and somehow we just didn't know how they got there. And so that's really what our journey was about. And I would like to underscore that we were definitely building upon the work of other folks who had gone before us, looking at engagement, looking at putting together some preliminary manuals on that. And so our journey is the next chapter of that. But we hope that you take what we've done and build your own and add to our chapters, because I think that's really where the power of ICN comes, when all the stakeholders can come together and work as a cohesive team. So we can go to the next slide, please. I don't have, unfortunately, any financial disclosures. Okay, we could probably zip through that. Okay, next slide, please. So we're going to jump to point of view. So usually when I do this, it's an engagement opportunity, so I'll have to pretend you're in front of me. But imagine looking at one of these little paper cups. And what I would normally do is ask people what they think it is. But for our purposes tonight, I would like you to put in the chat box what you think that object is. So I'm just going to take a moment. This is the participatory part of the program. So if you could just take a moment and chat in your little chat box what you think that object is. Right, I see some great responses. I see things like ketchup cups, medicine cup, a cup to take a pill. Anybody else? Last minute? Another pill cup. So the interesting thing is I did this project with a variety of different folks. Took this little object, I passed them out, they were on everybody's table, and I looked at it and I said, what do you think this object is? And then depending on the response, depending on the group, I got different responses. So I did this with a group of teenagers and they looked at it and almost universally, they said it was a ketchup cup. Yet I did it with a group of GI physicians in a grand rounds kind of situation, and they all universally said it's a medicine cup. And so I thought it was a really interesting perspective that we look at the same object, but we look at it in a very different way. So we could go to the next slide, please, Chris. So the interesting thing about these cups, for our purposes tonight, we're going to think about it as a ketchup cup. And so whenever I use these ketchup cups with my kids, I would typically use 5 or 6 cups because the ketchup never, it seemed like you never had enough ketchup. And then of course, once you dip your French fry in the cup, it spills all over the place. But what I didn't realize is that, see those little intricate folds of the paper cups? Well, they're actually designed to be unfolded and flattened out as you see in the picture here so that you can dip your French fry. And the point of this is, these little ketchup cups have been getting a bad rap for a long time. These little ketchup cups had so much untapped potential, yet we were looking at them in a completely wrong way. And I think the same could be true for when we think about our care centers, that we have such untapped potential when we're not collaborating, that once we unleash that, we can really accomplish so many amazing things. Next slide, please. So why collaborate? Next slide. Because the reality is we're better together. Next slide. So when we think about collaboration, nothing can replace the value of the lived experience. That patient activation is the core principle of Wagner's chronic care model for improved outcomes. So if we look to the right, there's a little illustration here. And so we look at our community resources and policies, and we look at our healthcare systems, and we look at all these various components, but then they sort of narrow down into the red arrow there, informed activated patients. All of that is a critical, important piece of the ultimate improved outcomes. And so ICN has really bought into this model and really shown that we really need to have activated stakeholders in order to truly improve outcomes. Our data suggests, though, that there's a significant opportunity to build more stakeholder collaborations within the ICN network. And studies suggest that as a result of this patient activation, we're going to be able to achieve better results. And so that's why we went about doing this project. Next slide, please. So we got to start at ground zero, right? So you got to assess the center's readiness to collaborate. And so when you think about, going in and having conversations with your physicians, if they're not ready yet to collaborate, that can be a challenge. So I would say if there are any centers on the phone, providers on the phone, and you're interested in collaborating with parents and patients, that it's normal for staff and clinicians to be both excited and anxious about involving parents and patients in the improvement work, but that it's a paradigm change, and change is hard no matter how obvious the potential benefits might be. And I think that you have to identify and acknowledge and address that within the team, and address any concerns early in the process to really develop a meaningful collaboration. Because if people are not ready for that, if they don't understand the benefit of that, and you haven't worked out those issues, it's going to be really hard to partner. Okay, next slide, please. Collaboration requires a shift in a new way of relating to each other. It's about partnering on equal footing to address gaps in care and opportunities for improvement. And each stakeholder assumes a shared responsibility to ensure the success of tasks and goals. And I can't underscore that enough. We have these relationships with our providers. It definitely is a different kind of paradigm switch, that you wear a different hat. And so at the community conference, I talked about this because, the idea that parents and patients can then be partners in terms of improving care is a huge paradigm switch, because oftentimes you're pigeonholed and seen in only just one way. And so I think about how, as a female, as a woman, I wear many hats. I'm a mother, I'm an administrator, I'm a volunteer, I'm a wife. I can assume many different hats, and I think we all have that we can share, and we can be lots of different things. And so in this instance, our individual parent hat needs to be put on the side, and then we work on behalf of all patients and families. And so it is a little bit of a paradigm switch. Next slide, please. So what kind of, as a center, recognizing who do you reach out to? So really we want to be looking for other parents who value the lived experience, recognize the value of the lived experience, develop people's own existing capabilities. So you might know a family, or you get together at an event and you recognize that somebody is really engaged. Those might be people to reach out to. You want to promote mutual aid and reciprocity. You want to break down barriers between care providers and parents and patients. And I think the most important thing is to listen and communicate well. Next slide, please. So what do those parent partners look like? They're proactive and engaged with their own health care. They accept and respect the HIPAA process, because that can be a big challenge. They're clear about the values and aware of that others might feel differently. See beyond their own experience. And again, we talk about that individual parent hat, and then we're working on behalf of all patients and families. So we look beyond our own experiences. We look to build consensus and compromise and collaborate on solutions. And then, you got to have the time and the resource and the experience and the knowledge and the will to really be able to dedicate this time. Listen well and ask questions. Again, respect diversity and different opinions, and can build relationships and a rapport with others. Next slide, please. So once you have parent partners, what happens? Next slide, please. Well, without an effective support structure, the team will struggle to function. And quite frankly, that happened to us. So our journey began In January of 2016, we had a group of physicians who were really interested in partnering with the parents and patients, and sent out a letter. We had a focus group. We created these great committees, and everybody was really gung-ho. We had about 18 parents, and then it was crickets for about probably 8 to 9 months. And so the reason for that is because there wasn't an infrastructure there to really get us beyond that brainstorming phase. And so my cautionary tale would be to be sure that you build that strong foundation, because otherwise your house will end up like this one here in the slide. Next slide, please. So creating team expectations and goals is really an essential element to that. Once a cohesive team is created, it's important to set expectations and goals. And then really considerations should be given to the team's bandwidth and how they'll work together. And that's, I would say it's probably one of our biggest challenges, because you know what, you need something done, you ask a busy person. And so every person on our team is involved in multiple other things, working full time, having families, having, children with chronic diseases, etc. So we need to figure out how are we going to work together and what's the best way to achieve our goals. Next slide, please. So things to talk about with your centers and with your parents would be the best way to communicate, for example. Do you set up regular conference calls? Is email the most effective way to do it? Is it an in-person meeting, etc.? What kind of tools will be used? Again, will you be doing virtual meetings like what we're doing today, or will you be using the email or set up regular scheduled things? How often will the team meet? How will projects be determined? What's the expectation on attendance and support of the programs? Do you expect the providers to be there, all of the providers, some of the providers? And then the big one is finances and fundraising. How do you get the money to really be able to promote your programs and really be able to facilitate those? So those are all considerations that need to be part of the conversation when you're setting those expectations. Next slide, please. And then I think the next thing you want to do is goal setting. And the thing about goal setting is you can start off small, and that's exactly what we did. I think, we were intimidated when we went to the initial conferences because, again, we had these really dynamic centers doing this incredible work and these just well-oiled machines. And we looked at that and we were just completely intimidated. I think, it's okay to start small. And the small might be, we're going to set up a group email so that if we get parents that are interested in joining our engagement group, there's a place for them to email. We want to create your own sort of database management programs. Well, you don't want to create it, you want to use one. So MailChimp is the one that we use. NationBuild is another. You want to recruit other patients and families for part of your center's engagement group. The thing that worked really well for us is a creation of an annual programming plan broken down into months with key dates and deadlines and programming ideas, so that we filled in all of those blanks, and that really became our roadmap to how we were going to move forward with our programming. And then the other piece of this that's really important is that you want to collect data along the way so that you know how to best respond to the needs of your families. So SurveyMonkey was one of the tools that we used, and we would use it both for pre-program surveys as well as post-survey evaluations, just so we learned how to improve our programs and see where those opportunities lie. I think the big thing, though, is that you want to have smart goals when you start off and throughout the process, because that will help move you along the continuum of improvement. You don't know where you're going unless you can measure where you've been. And so I think those are great opportunities to really use the tools that we use throughout the ISAN conference in a meaningful way to really be able to track and be able to measure your efforts and how that's impacting the patients and families within your centers. Next slide, please. So the nuts and bolts of program planning. You want to establish a budget. You want to agree on a date, often driven by when the presenters and space is available. Secure a space for the program, secure your presenter, advertise and market your program. Again, you can start small and build upon your success. Collection of data is an important way to learn about the effectiveness of your programs. And then I think it's a really important component of this to offer both social and educational programming, because really what we're talking about is building a community, a sense of community. And so those opportunities of just Time just to get together, just to chat with other folks is an essential part of building those relationships and making those connections. And out of that, just the most organic friendships and strength and support grows. So I can't underscore the importance of just doing those things. I think a lot of centers struggle with finances and understanding, like, how do we pay for these things? And so that in and of itself can be a great start to your programming efforts. So there's two schools of thought, and I think one of the things you want to think about is, how can we enhance the center's success? Although some people don't like fundraising, fundraising is a really great opportunity to build collaboration and to build support within your center and build value of that parent, patient, and center relationship. So a lot of hospitals have, I would say every hospital has a development department where their sole responsibility is to raise money for the hospital. I would encourage you to speak with your providers to be able to collaborate with the hospital's own development office, because they'll have a plethora of opportunities and fundraising ideas to help you as you move your programs forward. The other thing, especially if it's a nonprofit hospital, is sometimes they can give you letters and you can get in-kind donations. So for example, Costco, if you have a letter stating that you're a nonprofit institution such as a hospital and you're doing a program for children, they may allow, with that letter, you can get donations for refreshments and things like that. So check out those local opportunities, work with the development office. A lot of them have fundraising toolkits, and that's a great way to collaborate with both the providers and your hospital and add value to your center. Next slide, please. So marketing your programs, and this is, we definitely did a boots on the ground kind of approach. And so our physicians have been incredibly instrumental in helping us build this sense of community. And let's think about it for a minute. Pharmaceutical companies spend millions of dollars influencing physician referrals, right? So if you have your physician and you're partnering with them, one, engage them to do your programming for you. Listen, they're the experts. That's why we're bringing our children to them. And so there could be an area of expertise that they would like to do a program, an educational program around. So that's one of the ways to engage with your physicians. The other thing is, give those programming flyers to your physicians and have them hand invite their patients, because they're the ones who are going to be seeing the patients. That face-to-face invitation from the physician has far more significance than a flyer up on a bulletin board or even an email. So I would strongly encourage you to work with your physicians to be able to help promote your programs that way. But in addition to that, you do need to promote in passive ways through bulletin boards and flyers, the listserv emails. A lot of the centers have patient portal opportunities, so you can send out emails through the patient portals. The patient gateways, word of mouth, these are all ways to be able to promote your program. One word of note, so because of HIPAA, we couldn't just be given a list of all our IBD families. And so we needed to be able to give opportunities for the patients and families to contact us. And so that's the reason why you want to have your database email set up, so that there's a way for when families are responding, RSVPing for these programs, they'll email to your database, and then you ask them to be added, if you can add them onto your database listserv, and that's how you start to build your community. Next slide, please. So if you build it, they will come. And this harkens back to that movie, Field of Dreams. And so the idea behind it is that we're building this really amazing collaborative community, and that this is really our field of dreams. Next slide, please. So what are the benefits of engagement, community engagement? Well, these are just comments that we've gotten from some of our evaluations, but I think it's truly speaks to the ability of the power of our community. Thank you for your support and caring. It helps a lot. Thank you. Such a relief to have a support team. I'm so glad the boys came and had such a good time with other kids. Thank you for organizing this event. My daughter has found it helpful to be around other kids who understand what she's going through. We'll be contacting our legislatures regarding pediatric IBD safety registry. These are all examples of empowered, engaged parents and families, and this is really what the crux of what we're trying to do. This is the benefit of this engagement community. Next slide, please. So what we're trying to accomplish here is really an extension of what the physicians are providing. We know that patients and families live with IBD 8,760 hours a year. We know that on average, our physicians are only able to spend approximately 3.5 hours a year caring for your patient, caring for your kids. And so we need to be able to complement what they're able to provide to really provide holistic care for those parents, patients, and families. So from shared experiences grow strength, resiliency, and support. The educational programs increase the knowledge of the diagnosis and empower patients to better manage, cope, and thrive with their disease. Through engagement, patients and families become active participants rather than passive recipients of care. And again, studies suggest that high patient activation is associated with remission in patients with IBD. These are all really compelling reasons to really grow your engagement community. And these are great ways to, as you're building that relationship with your providers, these are really concrete benefits of how you're going to help enhance care within your center. Next slide, please. And again, we can't lose sight of why we're doing this, which is quality improvement. The purpose of the collaboration is to improve outcomes. It's important to measure and analyze your results from each program, utilize the QI tools to help, and then use your data and lessons learned to create new SMART goals for continuous improvement. And because really, truly, that's what we're trying to do, but we don't know, all change isn't good, and we don't know if what we're doing is truly improving care. So what we want to do is make sure that we're using those QI tools and those fundamentals to make sure we're moving along that improvement continuum. Next slide, please. So want more information on how to build a collaborative network? Well, if you can check out our parent-patient engagement manual on the ICN Exchange. And again, I would be remiss if I didn't say that this was a collaborative effort with all the folks who came before us, and so we owe a debt of gratitude to them for all the work that they had done and the foundations that were laid, because they enabled us to build on their work. And again, we encourage you to build upon what we've created to build something even bigger and better. Thank you so much. Really appreciate your time and efforts.